Here is a list of the most commonly tested autosomal recessive diseases. As a review, these diseases generally only appear in one generation at a time, since disease alleles are rare and a patient with the disease always has two parents who are at least carriers. Unlike autosomal dominant diseases, death or serious symptoms may occur before puberty. All the diseases listed here are covered in depth in other places, some of which in this chapter, and some in other chapters such as Hemonc. Cystic fibrosis is one of the autosomal recessive disorders and is caused by defect in the CFTR gene on chromosome 7, which stands for cystic fibrosis transmembrane conductance regulator. The most common mutation in this gene is a mutation of phenylalanine 508, which leads to an improperly folded protein which will be degraded by the cell. CFTR codes for a chloride channel, which actively secretes chloride in the lungs and GI tract, and actively resorbs chloride from sweat. Since water follows solute across membranes, the inability to secrete chloride results in thicker mucus in the lungs, the pancreas, and the liver, which can block pancreatic secretions and permit pulmonary infections, especially by Pseudomonas and Staph aureus. One of the first symptoms to present is meconium ileus in newborns, since the meconium is abnormally thick and forms a mechanical obstruction, resulting in abdominal distension and vomiting soon after birth. The majority of meconium ileus is due to cystic fibrosis, so if you see this symptom on your test, think of this disease. However, only a minority of patients with cystic fibrosis have meconium ileus, so don't use the lack of this symptom to rule out cystic fibrosis. One symptom that can be used to diagnose cystic fibrosis is the high salt content in the sweat, which is caused by the inability to reabsorb chloride. Some other symptoms include infertility in males, since the vas deferens are absent, and fat-soluble vitamin deficiencies, since they can't be absorbed due to the pancreatic insufficiency. You should also know that cystic fibrosis is the most common lethal genetic disease in Caucasians, and patients have an average life expectancy of 36 years. Treatment is supportive only, and one of the most commonly used drugs is N-acetylcysteine, which can cleave disulfide bonds within mucus glycoproteins to loosen mucus and allow it to be cleared. Can you think of another unrelated use for N-acetylcysteine? One common use is as an antidote for acetaminophen overdose. This is a list of the most commonly tested X-linked recessive disorders. Remember, these diseases most commonly affect males, who always inherit it from their mother. To remember this list, you can use the mnemonic, Be Wise, Fool's Gold Heeds Silly Hope, which stands for Bruton's A-gamma globulinemia, Wiskott-Aldrich syndrome, Fabry's disease, G6PD deficiency, ocular albinism, Lesch-Nyhan syndrome, Duchenne's and Becker's muscular dystrophy, Hunter's syndrome, and hemophilia type A and B. Again, these diseases will be covered in more depth in other places, but using this list and this mnemonic can help you remember which diseases are X-linked recessive. There are two types of muscular dystrophies, Duchenne's and Becker's. Both are X-linked recessive and both affect the dystrophin gene. Dystrophin is the longest known human gene, and therefore is the most likely to have spontaneous mutations. The dystrophin protein is cytoplasmic and is part of a larger multiprotein complex, which anchors the cytoskeleton of skeletal and cardiac muscle to the extracellular matrix through the membrane. Duchenne's is the more serious of the two. It often has an onset at less than 5 years of age and is caused by a frameshift mutation, which results in a completely non-functional protein. Without dystrophin, there is muscle breakdown, which causes weakness which begins and is strongest in the pelvic girdle muscles and progresses superiorly. These patients also get pseudohypertrophy of calf muscles due to the fibrofatty replacement of muscle tissue, and cardiomyopathy is common as well. The fatty replacement of muscle tissue can be seen in this image. Becker's is less serious than Duchenne's and results from a less functional dystrophin protein rather than a non-functional protein. The onset is a bit later, occurring during adolescence or early adulthood. The Gowers maneuver can be used to diagnose muscular dystrophies, especially Duchenne's, since it's more serious. This maneuver is trying to stand up without using your arms from a sitting position, and the inability to do this is usually due to muscular dystrophy. Diagnosis can also be made by looking for increased creatine phosphokinase in serum, or by doing a muscle biopsy to look for fibrofatty replacement. Fragile X syndrome occurs in about 1 in 4,000 people, and is a trinucleotide repeat disorder of CGG repeats in the FMR1 gene on the X chromosome, which stands for Fragile X Mental Retardation 1. The product of this gene plays a role in brain development. The trinucleotide expansion results in increased methylation, which decreases expression of the gene and also affects the chromosome structure, giving it a fragile appearance on microscopy. Patients present with macroorchidism, a long face and a large jaw, large everted ears, autism, and a predisposition for mitral valve prolapse. This is a list of the most commonly tested trinucleotide repeat disorders. You can remember them using the mnemonic, Try hunting for my fried eggs, which represents trinucleotide repeats, Huntington's, myotonic dystrophy, Friedreich's ataxia, and Fragile X syndrome. They can be inherited in a variety of ways. For example, Huntington's is autosomal dominant, and Fragile X is X-linked recessive. The number of repeats expands in the female germline, so when these diseases are inherited from a female parent, they exhibit anticipation, which again means that the age of onset is earlier or they become more severe. You should memorize the actual trinucleotide repeats, since this may help you answer an exam question. This mnemonic should help you remember at least the middle letter in each repeat. Ex-girlfriend's first aid helped ace my test. Autosomal trisomies occur when 3 homologous chromosomes are present in a zygote rather than the normal set of 2. This can occur due to a variety of defects during meiosis. Non-disjunction is when chromosomes fail to separate during meiosis. So non-disjunction during meiosis 1 will result in both homologous chromosomes ending up in one gamete, and non-disjunction during meiosis 2 can result in having 2 sister chromatids in one gamete. Chromosomal translocations, which we'll talk about in a couple minutes, can also result in autosomal trisomies. The 3 most common autosomal trisomies are trisomy 21, or Down syndrome, trisomy 18, or Edwards syndrome, and trisomy 13, or Patau syndrome. Trisomies of the other chromosomes are not viable. Down syndrome is the most common, with a prevalence of 1 in 700 people, and is the most common cause of mental retardation. Patients often have several classic characteristics, including flat facies, prominent epicanthal folds, and a simian crease, which means there's only one fold in the skin across the palm, as you can see here. They can also have a gap between the first 2 toes, duodenal atresia, and congenital heart disease, and have an increased risk of acute lymphoblastic leukemia and Alzheimer's disease, which they can get at a young age. The most common cause of Down syndrome is meiotic non-disjunction, which becomes increasingly common with advanced maternal age. At the age of 20 or younger, this non-disjunction occurs in only 1 out of 1,500 pregnancies, whereas in women over the age of 45, it occurs in 1 in 25 pregnancies. More rarely, this can also be caused by Robertsonian translocations, which I'll talk about soon, or Down's mosaicism, which is when non-disjunction occurs very early in embryogenesis, resulting in only some cells having the trisomy. Downs can be diagnosed during pregnancy by using an ultrasound in the first trimester, on which a fetus with Downs will have an increased nuchal translucency, and the quad screen can be used in the second trimester. It's called a quad screen because it measures 4 things in the mother's serum. If a baby has Down syndrome, alpha-fetoprotein and estriol will be decreased, whereas HCG and inhibin will be increased. Edwards syndrome is the second most common type of trisomy, with a prevalence of 1 in 8,000. It's much more severe than Downs, and patients have severe mental retardation, rocker bottom feet, micrognathia, which is a small jaw, low set ears, clenched hands, a prominent occiput, and congenital heart disease. These babies are usually born alive, but die within 1 year of birth. On the quad screen, you can detect decreased alpha-fetoprotein, HCG, and estriol, and normal inhibin A. The least common viable trisomy is Patau's, which only occurs in 1 in 15,000 pregnancies. They have some similar findings to Edwards, such as the mental retardation, rocker bottom feet, and congenital heart disease. However, they also have small eyes and a small head, extra fingers, a cleft lip or palate, and in some extreme cases, holoprosencephaly, in which the prosencephalon fails to develop into 2 hemispheres, which can cause fusion of bilateral structures, such as eyes across the midline. Everything in the quad screen will be normal in these patients. A chromosomal translocation is the exchange of genetic material between non-homologous chromosomes. It can either be reciprocal or non-Robertsonian translocation, in which DNA fragments are exchanged between 2 chromosomes, or non-reciprocal Robertsonian translocation. In the figure on the left, a translocation occurred between the bottom half of these 2 chromosomes, resulting in the bottom of the blue one becoming attached to the bottom of the yellow one, and vice versa. Robertsonian translocations can only occur between 2 acrocentric chromosomes, which are chromosomes that have their centromere near the end. It's caused by the replacement of the short arm of one chromosome with a long arm of the other, resulting in one chromosome having 2 long arms and the other one having 2 short arms. Since it's so small, the small one usually gets lost. But since there's only a small amount of genetic material in this, the loss does not cause death or significant disease. The chromosomes most commonly involved are 13, 14, 15, 21, and 22, since these are the acrocentric chromosomes. Down syndrome can occur if the long arm of chromosome 21 is translocated to chromosome 14. If this occurs in the germline and is passed on to an offspring, the offspring can end up with 2 normal 21st chromosomes and another one that's attached to chromosome 14, resulting in a total of 3 21st chromosomes. Balanced translocations don't result in the loss of genetic material, just the exchange of it between 2 chromosomes, so they don't cause an abnormal phenotype. However, unbalanced translocations can result in miscarriage or stillbirth. Cri-du-chat syndrome, which literally means cry of the cat, is a congenital syndrome resulting from a microdeletion of the short arm of chromosome 5. These patients have a small head, mental retardation, epicanthal folds, and cardiac abnormalities, but the most notable symptom is that they make a high-pitched mewing sound, which sounds like a cat. Williams syndrome is caused by a different congenital microdeletion, this time in the long arm of chromosome 7, which includes the elastin gene. Patients have distinctive elfin facies, mental retardation, hypercalcemia due to increased sensitivity to vitamin D, well-developed verbal skills, extreme friendliness with strangers, and cardiovascular problems. Deletions involving chromosome 22 at Q11 can lead to several symptoms due to the aberrant development of the 3rd and 4th branchial pouches. So what do the third and fourth branchial patches do? As we'll talk about in embryology, the third branchial patch develops into the inferior parathyroids and the thymus, and the fourth branchial patch develops into the superior parathyroids. The variable presentation of this disease includes a cleft palate, abnormal facies, thymic aplasia, which causes a T-cell deficiency, cardiac defects, and hypocalcemia, secondary to parathyroid aplasia. You can use the mnemonic Catch-22 to remember these. DiGeorge syndrome includes the thymic, parathyroid, and cardiac defects, while velocardiofacial syndrome includes the palate, facial, and cardiac defects.